All right. Hello, everyone, and welcome to today's Health and Wellness webinar, Ensuring Kids Thrive, Produce from Pregnancy to Preteen. We're super excited to have you joining us today. We have a wonderful panel of speakers that is brought to you by the Foundation for Fresh Produce. My name is Emily Holdorf. I am the influencer and community manager for the foundation, and it's my pleasure to be the host for you all today. So just a few background slides to start us off today. So we are the Foundation for Fresh Produce, and we are here to change the trajectory of human health. We believe that fruits and vegetables are the answer and that we must remove barriers that prevent people from eating them. And in thinking about these barriers, we are specifically focused on 4 strategic outcomes that you see here on the screen. Boosting appeal, so improving the appeal and driving the demand of fruits and veggies through culturally relevant content. We need consumers to choose and eat them. Improving access, just that, making them accessible, easier to eat and have more of. Nurturing fruit and vegetable professionals, so offering professional development like this here today through educational resources specifically for professionals like you. And then scaling partner impact, which is forming strategic alliances and stakeholder engagement that strengthen our collective impact globally. So as a foundation, we are global. We're thinking global, but we are acting locally. And what that really means and shows through in our work is our Have a Plant digital ecosystem. So some of you on the line here, I'm sure, are very familiar with our Have a Plant ecosystem. We have a really fun tagline of every time you eat, have a plant. It's easy to remember. It's more of an invitation rather than being super prescriptive. So just the 3 kind of outlets that I want to highlight here are fruitsandveggies.org. This is your ultimate fruit and veggie hub, your one-stop shop for all things fruits and veggies. We have a variety of recipes and resources that are both consumer facing and for you as professionals as well. We are present on social media using the fruits and veggies handle. And then we also do send out some e-newsletters for both our consumer and influencer or health and wellness professional audiences like you. So be sure to sign up for that if you haven't already. And then just touching briefly on some of the resources that we do offer specifically for professionals. Once again, a wide variety. We host these webinars. We have various influencer toolkits that are kind of grab and go. You can take parts and pieces and run with it. We have research insights that are really handy for grabbing and going as well. So really just a plethora of information that you can take and just really continue to do what you do every day in encouraging people to eat more fruits and veggies. So first, just a little bit of housekeeping. So you will receive credit for this webinar through CDR's CPEU prior approval program. So you'll get the certificate for that at the end of this. It'll be emailed out. Also, this is recorded, so feel free to sit back, relax. We'll be sending out the slides at the end of the webinar as well, and you'll receive those. So don't worry about if you missed something. You'll be able to get the recording and the slides afterwards. So next, here's just a brief look at the learning objectives for today. This, once again, will be sent out with the slide deck, so you'll be able to review these deeper. And then getting right into it, we have a packed agenda today, so I really don't want to take any more time away from our speakers. So we are joined by Sophie Egan today, and she will serve as our moderator. She is an internationally recognized author, strategist, and consultant shaping the future of food at the intersection of health, climate, and culture. So she'll lead us on a very good conversation today, and we'll round us out with some takeaways at the end. Then next we have Stephanie Hodges, a public health dietitian and food policy expert who focuses on helping strengthen programs and policies that expand access to healthy food. Next, we'll have Dr. Nikki Ford join us, Senior Director of Nutrition at the Avocado Nutrition Center, where she leads clinical research and nutrition affairs to advance the science on the health benefits of avocados and whole foods. And then last but not least, Tiffany Leon is the Assistant Director of Training and Professional Programs at FAIR, where she develops education and training to better support individuals and communities impacted by food allergies. So without further ado, I will turn it over to Sophie and she will take us away from here.
Thanks so much, Emily, and thanks everyone for joining us today. This is a really, hopefully fun and also really actionable way to spend an hour of your day. So I wear a lot of different hats, but I have been really, really excited for the last 2.5 years to be supporting the foundation in starting to map out a roadmap for actually starting to work towards this bold vision for public health. Next slide, please. So that vision, as you might have seen, is to grow a healthier world by changing the trajectory of human health. And these are big ambitions, but we really do think that it would be absolutely game-changing if every person on Earth ate the optimal amount of fruits and vegetables, and if we reduced the barriers that we know are kind of getting in the way of that. Next slide, please. So you see that we envision a world where people live longer, healthier lives as a result of lifelong fruit and vegetable consumption. And it's really this lifelong piece that is why we're talking today about especially early intervention and child nutrition in particular. We also really embrace the idea of not just a lifespan, but a health span. So the quality of one's years, not just the length. Next slide, please. So one of the first things that we did as the foundation, which is such an exciting sister organization to the association, was to produce a framework, a novel framework called The Power of Pull, that really distills what are the top drivers of fruit and vegetable consumption, and really takes a holistic view. If you go to the next slide, please. What you see is, if you've ever seen the fable about the blind man and the elephant, it's really common, especially, and my background is public health, which is all about systems change, right? It's really common that each of us is head down doing our piece of work on our piece of the puzzle or our piece of the problem. In the fable, each person is just touching one part, thinks the tail is a rope, or thinks the trunk is a snake, or the side of the elephant is a wall, right? And is not able to see that they're actually part of a much more massive, but also interconnected whole. So on the next slide, please, what you see is that in this Power of Pull white paper, we've really attempted to simplify, but in some ways complicate, the understanding collectively among public health practitioners and especially policymakers of what are these interconnected drivers. We think of it almost like a Rubik's Cube, that if you're, again, kind of tunnel vision, just working on access, like access absolutely is a top driver. We have identified these 3 big drivers on the left: access, appeal, and attitudes, across 3 main spheres of influence. The individual or personal, sometimes the household level, the social, kind of institutions like schools, hospitals, universities, workplaces, community centers, and also the social norms wrapped around those institutions. And then the physical, really the marketplace, what's available on shelves in grocery stores and on menus away from home at restaurants. And what is the sentiment among decision makers and gatekeepers in those contexts? So this 3x3 is really trying to paint that picture of the whole, and also invite policymakers and public health practitioners to design programs that, whenever possible, embrace what we call multi-solving. So not just kind of addressing one driver at a time, because sometimes if we're solving only for access, and I'm a math nerd, so this is like the biggest multivariable equation, that you may be disappointed if it's not producing the results that you're looking for in terms of moving the needle on consumption or health outcomes, until you layer in, again, kind of in tandem, program and policy elements that also account for these other drivers. So that's really the main idea here. Next slide, please. our speakers today are actually going to bring to life some of those kind of barriers and solutions that high-level framework is intended to address. But zooming out even more, as a global foundation, we felt it really important to articulate more than just that single sentence of changing the trajectory of human health, to articulate our theory of change. How do we see fruit and vegetable consumption as being actually in that causal relationship to lifelong health for everyone? What we saw in global health communities is that actually food is often not even described as much as you might think, especially from not just food as medicine, but kind of eating for health. And so we really wanted to elevate its importance, but situate it within the context, not pretend it's a magic bullet. There is no one solution. So we've now released a theory of change for lifelong health, embracing not just, again, the lifespan, but the health span, and taking an opportunity to identify where we can focus for maximum impact. So early intervention in child nutrition, that's what we're here to talk about today. Food as medicine, and public-private partnerships for nutrition equity. And again, these are interconnected as opposed to kind of siloed focus areas, but they really give us kind of a roadmap. What I'll share in the chat in a moment, the link to the theory of change, but we also identified 6 major levers. So not to out framework you all or framework you all to death, but really leaning into kind of theories of behavior change. My background is certainly in health and social behavior and behavior change, and again, what works at a population level. So when you look at the cross-cutting themes of what we're going to talk about today, and what's cross-cutting levers throughout the different programs that we're going to stand up and continue to support as the foundation, they're culture shift, availability and access, affordability, healthcare integration, policy infrastructure, and the business ecosystem. So again, you're seeing public and private, kind of those different levers of individual, social, physical, and everything in between. We've also begun to map out some initial impact metrics, because if we're not measuring it, we really won't be able to know if we're moving the needle. And again, why we see this moment as so critical is that 1 in 10 Americans eats the recommended amounts of fruits and vegetables. For those of us who've been working on this for a very long time, this is I talk about, right, like elephant in the room. It's a thing we hate to say, but it's also the fuel in the rocket ship. It's why we need different approaches. We need more, again, holistically designed, and we need better, more comprehensive ways of measuring the work that we're doing collectively. Next slide, please. So today, just about an hour ago, we are really thrilled to announce the formation of the Child Nutrition Education Network. And this is the first major new program within, as you saw, that first focus area. And it aims to bring together the nonprofits, funders, and other relevant allies in this space who know how critical this is. They do this work every day. They've been doing it for years. Next slide, please. And yet, while doing that, they often share a lot of similar challenges. Sorry, I'm seeing a comment that I'm echoing. I don't hear an echo, but apologies if you're hearing an echo. Next slide, please. So they really have unique approaches. There's over hundreds of organizations working in, some work in schools, some work in gardens, some work in aftercare settings or summer camps and so forth. They all have a really fantastic approach, but there's an opportunity for more resource sharing, knowledge sharing, and help troubleshooting the common pain points and challenges. Next slide, please. So we did an in-depth needs assessment for much of the past year with stakeholders to understand, was this in fact a gap? Was there a need? Would people want to actually work with one another? And there is a huge need, and now absolutely is the time, especially amid particular cuts. Next slide, please. So we have 3 main goals to build the network, starting with a network map that will help visualize and streamline organizations' ability to connect with one another for funding relationships, for partnerships, collaborations, and again, just that critical knowledge sharing. Create capacity through upskilling and in-person leadership retreat for key leaders, and increase funding, because this is the thing that every single person shares, every organization shares. And it's only through providing, really what's missing is a collective voice, almost a kind of spokes, a platform for food education as a sector. Next slide, please. So there's a lot of different ways to get involved, from the light touch to just an affiliate kind of being on an email list. You can just stay apprised of what's happening, all the way to the highest touch of actually coming to an in-person leadership retreat that will happen next year. So I have one last slide, and it's just to say we invite you to share the news of this new network, to please check out the Theory of Change, and to reach out to me, and I'll put my email in the chat, for ways that we can work together to change the trajectory of human health through the power of fruit and vegetable consumption, especially among our youngest little ones out there. So with that, I'm going to hand it over to, we're going to have three kind of rounds of solutions and barriers, again, that really bring all of this very abstract, up in the sky stuff that I've been talking about down to planet Earth. So over to you, Stephanie.
Thanks so much, Sophie. Thanks so much for having me today. I'm really excited to be talking about one of my favorite public health nutrition programs. If you're not familiar with WIC, it stands for the Special Supplemental Nutrition Assistance Program for Women, Infants, and Children. So it's often abbreviated as just WIC. It's the nation's premier public health nutrition program that improves the dietary intake of children and pregnant and postpartum women. It reduces rates of low birth weight, it reduces fetal deaths and infant mortality, and it decreases iron deficiency anemia in children. WIC participants receive nutritious foods to supplement their diets, information on healthy eating, including breastfeeding promotion and support, and referrals to healthcare and other social services. In FY23, WIC served 6.6 million participants, including 39% of all infants in the U.S. WIC is administered locally by 89 WIC state agencies, including states, Indian tribal organizations, and territories. WIC vendor requirements in many of the food package elements are determined at the state agency level. Next slide. There was a final rule released in April 2024 by USDA that was based on the most recent dietary guidelines and a National Academy of Sciences report and those recommendations. Notable changes were made to the WIC food packages, and one of those was permanently increasing the cash value benefit, or CVB, for fruits and vegetables. You may also heard this referred to as a cash value voucher, CVV. You can see here what those levels are, and they increase too. So about $26 a month per child, and then it ranges for women depending on what food package you're on, but anywhere from $47 to $52 per month for women. The food package changes led to more choices, more balance, more flexibility, and more support. And you can also see here the differences in the food packages broken out by ages. Next slide. So today I'm really going to focus on the cash value benefit and the redemption of it. We saw with this increase of the amount of the cash value benefit that, no surprise, fruit and vegetable consumption increased by about a third after this cash value benefit increase. Dietary diversity also increased. So previously at the kid $9 level, we were only seeing families purchase about 2 fruits or 2 vegetables. But at the $35 level, which happened during the COVID pandemic, we saw families purchasing 5 fruits and 4 vegetables. So pretty significant jump. 92.5% of WIC shoppers cite fruits and vegetables as their primary reason for continuing enrollment in the program. And when the cash value benefit amount increased, WIC shoppers spent more money across nearly every produce type. Multiple studies link WIC with improvements in the retail food environment, healthful food purchases, overall diet quality, and the consumption of fruits, vegetables, whole grains, and lower fat milk. Next slide. So in today's presentation, I'm really going to focus on that cash value benefit and the national redemption rate of 73 to 77%. Next slide. Last year, the International Fresh Produce Association, or IFPA, conducted focus groups and interviews with stakeholders all throughout the supply chain, including WIC participants, to better understand that redemption rate of the cash value benefit. You can see here the number of individuals included and what industry or role that they serve in. Next slide. Out of those focus groups and interviews, we were able to identify barriers for everyone that we talked to. And then later on in the presentation, I'll talk a little bit about those proposed solutions. So starting off with the barriers that we heard directly from WIC participants, one thing that we really wanted to focus on too, are just how they like to shop. What are their preferences? So you can see here, I won't read every single one of these, but they preferred fewer, larger shopping trips. Makes sense. They often couldn't shop at their preferred options with WIC because those stores did not accept WIC, like Sam's Club and Aldi. Location and convenience convenience obviously played a really important role in store selection, and some participants described using multiple stores strategically. So maybe they shopped at one store that didn't take WIC with their SNAP benefits, and then they shopped at another WIC-approved store with their WIC benefits. They did note that fresh produce was consistently the first choice across all participants. Several mentioned that their children's preferences really drove the choices that they were making. They also had a tendency to stick to items that they knew would be WIC eligible to avoid any surprises at the register, namely items being rejected. So they also pointed out a lot of different barriers, juggling multiple benefits, knowing how to understand the programs, knowing maybe where they could use farmers market vouchers, and just how this really makes their shopping more complex. They also noted transaction friction at checkout when items did not ring up as WIC eligible, whether they truly weren't eligible or they were just ringing up that way. They also noted encounters with cashiers and shoppers who maybe showed frustration with slower WIC transactions. And then some also found it easier just to use SNAP for their produce since it had fewer restrictions and it could be used at their preferred stores. Also, WIC is a little bit behind in that they don't have a lot of the online shopping options. And so they noted that there's this inability to use WIC for curbside pickup or delivery services. And that can be really challenging, especially if you're shopping with multiple children or maybe you have transportation limitations. Next slide. So we spoke with state and local WIC agency staff as well, and they noted several different barriers, which I think are really important to figuring out how can we make things similar across state agencies, but then also maybe where there needs to be individual technical assistance. Overall, just really the idea of complex produce mapping. And so that's done at the store. And so really figuring out how we ensure that if a produce item is WIC eligible, that it's ringing up as such at the cash register. Each state establishes their own, it's called approved product list, APL, and so that can also be part of that challenge. If there's new products being introduced, that can also be a barrier if they're not coded correctly. Implementation can look a little bit different at each store, so that also could be a challenge as there can be inconsistent processes between stores. There can be scanning mandates versus a manual entry. If produce is packaged, that could create additional complexity. They also noted transportation stigma and language barriers for WIC participants, as well as the importance of recognizing cultural food preferences and just that a lot of these families have a lot of different competing priorities. Next slide. And so now focusing on the retail staff. So I know we probably have a lot of retail folks, including dietitians on the call. And so we're really excited to be able to highlight what those retail staff told us in terms of barriers, and then later on share some of those recommended solutions. So they really noted that there's this complex system of PLU and UPC codes that requires this extensive manual linking of codes at the store level. They noted that it's really impacted the way that WIC shoppers shop for produce. There's training and knowledge gaps present, and that really poses another significant challenge. And this is of the store staff, whether this be at the management level, at the cashier level, or even just someone stocking. Store staff have developed creative workarounds to make it easier for WIC shoppers, which is really appreciated. The retail team also noted that there's culinary knowledge and food preparation barriers that were frequently mentioned. You know, one dietitian said the 15 ingredient recipe maybe is not the starting place for this population, but also noted that there's this lack of coordination between retailers and WIC agencies, whether this is at the state or local level, and that there's a real opportunity for cross-training. If the state is educating their staff or the local WIC agency is educating their staff on how to teach WIC participants to shop in their stores, that's a really big opportunity for collaboration. Next slide. And now
Stephanie, I just want to hop in here briefly as we're talking about WIC, because I know avocado is best, of course, and I know avocado research really, really well. So I know that data shows avocados are one of the most commonly redeemed vegetables in the WIC program. And like you mentioned, redemption rates go up when the CVB increases. But also we've noticed that over the last 2 years that avocado purchases among SNAP and WIC households are actually up 8%. And then when avocados are in those carts, total produce spending is higher. So there's more produce ending up in the cart when an avocado is there. In fact, we looked at SNAP and WIC baskets, and avocados are often paired with bananas and tomatoes and berries. But something interesting is that kiwis, lemons, and squash are over 10 times more likely to show up in the baskets of avocado consumers. I would say that even better is that these shoppers are also picking up things like milk and yogurt. suggesting that maybe avocados are like a sneaky little gateway to better diet quality. So I hope you don't mind me hopping in there.
No, that's great. I really appreciate the additional context. And I think that just goes to show, we had this policy change with making this cash value benefit permanent. And so we see the result of that is people are purchasing more fruits and vegetables and they're able to diversify their diet. So thanks for sharing that. And I'm actually going to turn it over to Tiffany.
And I'm so glad that you talked about diet diversity, as we'll talk about that in a few slides. But first, I want to just lay the groundwork for for food allergy. This is a medical condition in which an exposure to a food triggers a harmful immune response. Now, this food is typically seen as normal, and suddenly in a person with a food allergy, it is mistaken as a threat. And while typically these are diagnosed in infancy or childhood, we are seeing adult onset of food allergies. We're seeing it diagnosed later. So while we're talking about child nutrition today, diagnosis can occur at any age. Reactions can vary from person to person. It can involve multiple systems of the body. This is called anaphylaxis when more than one system is involved, but there can be hives or rash. You may see respiratory trouble breathing. You may see cardiovascular system involved with this drop in blood pressure, digestive system reactions. As I said, it can be life-threatening. It can be fatal. Now, the treatment, and I will say that there are 33 million Americans that are managing this condition. The treatment right now is avoidance of the allergen. There is no cure at this time. And in the next slide, we're going to look at some of the risk factors for developing a food allergy. So infants with severe eczema are at highest risk of developing a food allergy. And while there may be a small genetic component to the different atopic conditions, moderate to severe eczema and or previously confirmed food allergy, specifically egg, are the biggest risk factors for developing a food allergy. Now, diagnosis of mild to moderate or moderate to severe eczema can be subjective depending on the physician or dermatologist. But I've added some photos here so you could see some examples of what severe eczema looks like. This is very red, broken skin, rough patches covering large swaths of the body. And again, like you can see some examples here. So now that we know what a food allergy is and what the risk factors are for developing a food allergy, I want to take a look at the professional guidance related to early introduction or early infant feeding, as they transition to solids and hopefully prevent a food allergy. So we have here the 2020 dietary guidelines, which as there may be some dietitians here, in the room, and we are very familiar with these. So around 6 months, when developmentally ready, introducing nutrient-dense complementary foods. We're talking veggies here. I know we're talking about plants, fruits, vegetables, grains, super important. But then it also goes on to say introduce potentially allergenic foods alongside these other complementary foods. And then we have the 2021 consensus guidelines. And this is one set of guidelines from joint organizations across North America, allergy organizations, and they say to prevent peanut and or egg allergy, both peanut and egg should be introduced around 6 months of life, not before 4. We're not trying to feed 3-month-olds these foods. So not before 4, around 6 months. And other allergens should be introduced around this time as well. Upon introducing complementary foods, infants should be fed a diverse diet because this may help foster prevention of a food allergy. So here we're seeing support from these two professional guidelines here to support early allergen introduction, feeding these allergens early, and a diverse diet packed with plants. So guidelines are great, but we need actionable steps. So in the next slide, I have a few steps to move from guidelines to action. So number 1, feeding the baby when developmentally ready. We already stated this is usually around 4 to 5 months. For my little ones, it was around 5. You want to make sure that they have these gross motor skills. They can sit up and they're interested in food. We want to start with the low risk allergenic foods. So starting with the banana, starting with the green beans, starting with the oatmeal, starting with these yummy plants, making sure that they are interested in feeding, having this swallowing reflex, know what to do when it's in their hand. And then we can proceed to allergenic foods. Now we want to make sure they are infant safe forms of these foods. So on the right hand side, you see this is one of the resources that FAIR offers. This is on our food allergy prevention site, and I can drop the link in the chat in a second, but these are different options or different ways to serve peanut butter safely to an infant. Chunky peanut butter is not the way to go. You want to choose creamy peanut butter, and you want to thin it out with water, breast milk, or formula to make sure that it is the right consistency for the baby to be able to swallow. A big spoonful of peanut butter could be a choking hazard for the baby. There are also peanut powders that you can use. There are like immunobutters that you can use. There are puffs that you can use. So there are different options, but you want to make sure that once you've determined which one you want to feed the baby, that you continuously feed it if there is no reaction. We want to make sure that we're getting this in 2 to 3 times a week if the baby is able to tolerate it. Of course, if there is a reaction, we want to stop feeding immediately and seek treatment. Now, anaphylaxis is, in food allergy, we never say never, but anaphylaxis in an infant is rare. A lot of times it will be a skin reaction. You will see some redness or hives developing around the mouth or on the hands or on the skin. So if there is a reaction, we want to stop. But if there's no reaction, in the next slide, we'll talk about how we can move from not only early, but to continue to often. So research supports continuous intake until age 5. There are so many ways to incorporate these allergenic foods into the baby's and infant and toddler's diet up to age 5. I have some examples here, but peanut butter and other nut butters can be used as a gateway to other produce. I know Nikki mentioned avocado as maybe a gateway to some of these other foods, but peanut butter or nut butters can be used as a gateway. My little ones really love apple slices, so why not pair that with almond butter? Or my kids love banana smoothies. Why can't I should put like a spoonful of peanut butter in the banana smoothie so we can make sure that we're getting these foods that have been introduced and tolerated into their diet regularly. And there was a systematic review of about 17 high-quality studies that found consistent evidence that increased diet diversity, and this is why I was so happy that we talked about it. Stephanie talked about it, and Nikki too. But increased food diversity in infancy effectively prevents food allergies. So when people ask after peanuts what we should introduce, usually I do say egg because that's another potentially allergenic food and a risk factor for developing additional food allergies. But after that, it should be in accordance to how the family is eating. So if the family eats a lot of soy in their diet, or the family is eating a lot of sesame in their diet, or tahini, we want to make sure that those are higher priorities for when we are introducing the food. So according to family and cultural practices, and as dietitians, we can work with families to incorporate more veggies, more grains, more fruits. And one of those powerhouses, and maybe one of those gateways, is avocado. So I will pass it off to Nikki to share more.
All right. Well, thanks, Tiffany. Yes, I'm really excited to share some of the fascinating research on avocado intake during pregnancy and how it may relate to infant allergy outcomes. So this study, you'll see the full citation at the bottom of the slide, explored whether eating avocados during pregnancy could influence allergic conditions in babies. So what we did is we looked at data from a prospective cohort of 2,272 Finnish mother-child pairs. Avocado intake was assessed during both the first and the third trimesters, and then we tracked allergic outcomes in the infants at 1 year of age. This included rhinitis, paroxysmal wheezing, atopic eczema, and food allergy. Next slide. In this study, infants whose mothers reported eating avocados during pregnancy had a 44% lower likelihood of being reported with food allergies at 1 year of age, even when we adjusted for all the many different lifestyle factors. Interestingly, though, no associations were seen with the other allergic conditions. And so this is a really great example we keep coming back to everyday food choices that, particularly during pregnancy, something like eating an avocado may play a role in shaping long-term health outcomes for the next generation. Next slide. So why might we be seeing this effect? Allergy development is complex, but diet quality does seem to play a role. This was just mentioned. Avocados are nutrient dense and they provide a wide range of vitamins, minerals, and phytonutrients. Because they contain healthy fats, they also act as a nutrient booster, helping the body to absorb fat-soluble nutrients. And then through the immune perspective lens, there are a few nutrients that stand out. And avocados are a good source of fiber, folate, vitamin K, copper, and pantothenic acid. Next slide. So to wrap up this study, I want to share a few easy ways that moms can add more avocados to their meals. So avocados are simple, they're versatile, they fit into a wide range of flavor families. We just talked about cultural relevance as well too. So things from being plant forward to maybe more indulgent dishes. For babies, early exposure to a variety of foods is key. We keep hearing this, and avocados make a great first food. They can really help set the stage for healthy eating patterns later on in life. And so here are some of the examples of how that might look for both moms and for little ones. So now let's transition to outreach and engagement, because how you tailor a message can really depend on the age group and the demographics and the group with whom you're actually working. Next slide. So let's talk first about teens and adolescents. Next slide. We all know that diet quality across the United States isn't great, but kids ages 9 to 18 actually have the poorest scores on the healthy eating index. Combine that with the fact that more than 1 in 5 kids are living with obesity, and that number has been climbing dramatically. And that type 2 diabetes diagnosis in youth have been rising about 5% every year for quite some time now. You can easily see this challenge. From the avocado lens, this age group really should be aiming for 2.5 to 4 cups of vegetables daily. And then for young females, especially, nutrients like folate, B6, B12, and iron are often falling short. So what is the big picture? This really is an age of opportunity. If we can engage with adolescents and teens and their parents now, we really do have an opportunity to set up healthier patterns that last into adulthood. Next slide. So let's go back to the research for a moment. We supported a study looking at whether avocado intake among adolescents and teens was linked to their overall diet quality and also body composition. So here's what the study looked like. It included over 500 adolescents ages 12 to 18 years of age. Their avocado intake was measured using a food frequency questionnaire. And sometimes this can be really great for avocados because people don't eat avocados every day necessarily, but they can be captured a little bit better looking back in time. But then researchers looked at a range of outcomes. They looked at overall diet quality. They looked at components of diet quality. They looked at BMI, weight to height ratio, fat mass, fat-free mass, and then body composition or percent body fat. So essentially what we wanted to know was, do teens and adolescents who eat avocados have better diets? And does that show up in their body composition measures? Next slide. Here's what the researchers found. Kids who eat avocados had better overall diet quality. They also consumed more fruits and vegetables, more fiber, and higher amounts of several key vitamins and minerals. And then importantly, whether kids ate avocados or not, there was really no difference in body weight, waist circumference, or body composition. So in other words, avocados didn't contribute to weight gain. Next slide. So I want to bring this all together. 1 avocado counts as 1 cup of vegetables. And then even just 1/3 of an avocado, which is the rack, provides meaningful amounts of nutrients. Things like folate, vitamin B6, and iron are listed here. And it's not just kids, though. I do want to mention that there is plenty of other research showing that adults who eat avocados also tend to have better diet quality. So to me, the takeaway is that avocados can be a very simple and practical solution for the whole household. All right, next slide. Gonna hand it off at this point.
Thanks so much, Nikki. And I know that I presented a lot of barriers earlier in the presentation. So now to bring it back around, I'm going to talk a little bit about some of the recommended solutions at varying different points in the supply chain to really increase that WIC cash value benefit redemption rate, because we would love to see it closer to that 100%. So the first slide that I'm going to cover are recommended solutions at the retail level, and there were a lot of these. A few include enabling online purchasing with delivery and curbside pickup capabilities for WIC purchases, and this is something that at the national level is being worked on. Standardizing processing, training, and resources within retail chains to permit more consistent experiences between store locations. Also standardizing produce lists across states and removing any restrictions on culturally important produce items. Moving potentially from a PLU system to a universal UPC or barcode system, and also improving UPC linking to state-approved PLU codes. Improving the retail knowledge and awareness of WIC eligible items and WIC redemption processes by customizing trainings and job aids for different staff types at the retail level. Create collaborative training opportunities between retail dietitians or staff and WIC educators. Conduct store walkthrough programs for store staff, retail dietitians, and WIC state and local agency staff to really understand that customer experience. To also provide more shopper education and reminders through things like apps and even text messaging, and to expand culinary education, focusing on simple preparation methods and guidance on longer shelf life produce items, as well as storage tips. Next slide. And so now focusing on that administrative level, so this is really at the state and local WIC agency level, but also could inform discussions at the federal level as well. The first thing is being this, and you'll hear it again, standardizing produce lists across states and removing any restrictions on culturally important produce items. Again, updating that PLU UPC code system to just really work for the WIC participant. There are also a lot of business opportunities that come along with this. Improved knowledge and awareness of WIC across the supply chain with growers, distributors, and retail leadership, and really showing that business case for being a WIC store and the value of WIC customer engagement. There's also opportunities to better improve data, better utilize that redemption data to identify trends and issues. You could also share this with growers and suppliers, but retailers have the option to talk to their WIC state agencies and say, hey, we'd love to see our data. We'd love to see where people are redeeming. And this is for the whole food package, not just CBB. Where are people redeeming? Maybe where can we work on this and really work that into their retail operations. They can also better track and address specific store level issues, especially if they're seeing maybe discrepancies from store to store, and even potentially think about targeted outreach to participants with low redemption rates. One of the most interesting quotes, I would say, from the focus groups that we did is actually for someone that now works at a WIC state agency who was a WIC participant themselves many years ago. And they had such a really great opportunity, or they had such a really great experience when they were on WIC at one specific retailer that to this day, they still shop at that retailer. So it really does show that there's a business case for bringing, maybe not, you're not going to be on WIC forever. However, those experiences can really shape shopping habits for decades to come. Next slide. And then lastly, I'm just going to wrap up with recommended solutions for the produce industry. So one is really focused on product availability with growers, suppliers, and distributors. How can they determine ideal packaging sizes? By analyzing WIC shopper habits and preferences. They can assess product lines to determine what items do not meet WIC eligibility requirements and determine if any adjustments can be made. They can also improve packaging to help prevent food spoilage and food waste, and also thinking about maybe moving away from weight-based pricing to per unit pricing where possible to make pricing more transparent and predictable. I think we've all grabbed 5 apples and had no idea how much that was going to cost when we get up to the cash register because it's labeled by weight. And so thinking about how that might impact someone, especially if they have a limited benefit like the CVV. And then I'll just show on the next slide. We had a graphic designer put together kind of all of this in one graphic, and I won't spend too much time here, but it's just a really interesting and fascinating process of, we take another apple, all the way from the grower to the distributor to the retail store. You have your WIC shopper potentially using an app. You have their transaction at the cash register or self-checkout, and then you have them going home and enjoying their apple. And so there are a lot of different things at play, but just really goes to show the importance of engaging each one of these stakeholders all along the way. So next slide. And I'll turn it back over to Tiffany again.
Thank you. Thank you, Stephanie. And I'm glad we're talking about WIC today because FAIR, and we'll talk about this awareness slide in a second, but FAIR is also doing some national level advocacy to try and get peanut butter as part of this infant food package so that we can use some of the steps, some of the guidelines that I presented earlier to get peanut butter in some of these households that are using some of these benefits as well. So, but for this slide for this study that I'm going to be presenting on here, FAIR is working to raise awareness of guidelines and all these actionable steps to prevent a food allergy. But we wanted to see where we were or where the healthcare professional cohort was at baseline. And this is the first study to measure awareness and implementation of those prevention guidelines in a nationally representative sample. And this is clinicians across a broad pediatric healthcare workforce. And so we surveyed pediatricians, dermatologists, family physicians, and advanced practice practitioners. And the group that reported awareness of the guidelines at the highest level was pediatricians, coming in around 75%. It got lower when we talked to dermatologists, somewhere around 60%, 52 of family physicians, and only 45 of the advanced practice practitioners. And considering that the first guidelines that were published on early introduction, this was NIAID in 2017, these numbers are still pretty low. And even then, the pediatricians who have the attention of the parents at the 1 month and 2 month and 4 month and 6 month visits have so much to go through when you're talking about other milestones and other recommendations at each visit. Sometimes, even though the physician is aware of it, they just don't have time. So there's so many barriers to getting this information to the parent or the caregiver. And so education for all pediatric clinicians, like we would love to get this, to have each group get to 100%. It's really urgently needed to promote evidence-based peanut allergy prevention practices. And I think I'm allowed to do this because this is approved by CDR, but FAIR did put together a prevention specific module. So we do expand on all of this, and it should be available on the CDR's website in the next month or so. So if you are interested in learning more, then we can send you the link there. But we do have some additional actionable steps for providers to bridge the gap on the next slide. So we just want to I'm just going to wrap up here with the provider's role in raising awareness, translating these guidelines into practical steps, assessing the risk of developing a food allergy. Now you know the risk factors: eczema, previously diagnosed allergy, confirming developmental readiness of the infant, making sure they have these skills to do early introduction to start infant feeding, and offering encouragement to the parent caregiver during this introduction stage. Feeding babies is really hard. It can be like a lot of work, and mom and dad and caregiver are already dealing with so many things, like around 4 to 6 months. And so we want to make sure to highlight ways to incorporate some of the common allergens into regular meal cadence, so that we're not only eating early or feeding these early, but feeding this often. And I think we're going to do a quick roundup with everyone.
Yeah, absolutely. Well, thank you so much to all three speakers. Hopefully for the audience, this really, again, kind of made more tangible some of the things that I spoke about at the beginning, right? The critical importance of particularly early intervention, not only from the education and engagement and communication perspective, at prenatal and childhood stages, but with the actual exposure to these different foods, preference formation, palate formation, all of these things. You also see things we discussed around cultural relevance and norms, not only availability, but the appeal dimension. And then of course, with WIC and SNAP, the critical piece around affordability and availability and access as the big overarching driver there. So really appreciate those very tangible examples where there are clear barriers, but there are also clear solutions and key takeaways from each of our panelists. So lightning round, call to action. You can jump in as you're ready, panelists, but in 1 minute each, what is one thing that each person here can do to improve access, appeal, and/or nutrition education for children in order to close the fruit and vegetable consumption gap for families nationwide? Just a little softball question. But you only have to pick one thing.
I can go first since I was the last presenter here. I would just say, remember early and often, I've mentioned this a few times as, preventative strategy for food allergies. But we also talked about the benefits of diet diversity and incorporating more fruits and vegetables, more grains, more plant-based foods into the diet. We didn't really get to talk about mom's maternal diet right now, but the research is showing that maternal diet, a diverse diet diversity for a maternal diet can also be preventative for a food allergy. Now, we don't want to medicalize this and say that you need to feed 2 teaspoons 2 to 3 times a week to prevent a food allergy. And it doesn't mean that you need to feed 150 foods before age of 1. But if there's one takeaway, 6 new foods is better than 4, and 8 new foods is better than 7. And as I said, feeding babies is really hard work, but with each new food that's added into the infant's diet, you can help prevent a food allergy, especially with introducing those top allergens early.
So I'll hop in there with one food, of course, avocados. So one thing that's interesting about avocados, of course, is that people typically, if they like them, they actually love them. And so I would say the key takeaway would be to encourage moms to be, or families to include avocados regularly. The research we showed in pregnancy was eating avocados is linked to lower risk of developing food allergy in infants at 1 year of age. For teens, we saw improvements in diet quality and then without any changes in body composition or weight. So really to make those changes easier, again, focus on families, suggest really simple strategies. Offer an avocado as a first food for babies. Then swap it into sandwiches or salads for teens, and then maybe use it as a quick nutrient-rich vegetable for parents. So thinking across the entire lifespan at once.
I love that. Stephanie?
Yeah, I can wrap us up. So I think there's a lot that each person can probably do on this call, and it really depends on the area of practice that you're working in. But I think as all of us as consumers, just be a little bit more patient when we are in the grocery store, the supermarket, or the farmer's market, as there may be people who are using WIC benefits and they need that extra time or they need that extra patience. If you're WIC staff, maybe working more with retailers to reduce those barriers, especially around coding, but then also figuring out where the opportunities are. And then if you're working with the WIC population, make sure that you're really tailoring to culturally relevant produce items that are accepted in WIC, but then also to make sure that any recipes that you might be creating are easy and accessible. And especially as we're thinking about people having a lot to juggle and having a lot of responsibilities, making sure that they're really attainable for really busy moms and parents and caregivers. So thank you.
Yeah, fantastic. Well, thanks for all the terrific questions coming in the Q&A. We've addressed many of them, in tandem here with the discussion. But I want to give our panelists a chance to answer some that are a little bit related to each other. So, Tiffany, I want to start with you. I'm seeing several kind of clarifying questions. Dennis or Denise, should one stop feeding the allergens if there is a small allergic reaction or keep going? And then somewhat related from Anna is there a more specific timeline in terms of, you mentioned introducing safe foods first? Is it just once baby tolerates the safe foods? So kind of just on this, how do we make sure we're doing this right question?
Sure. So we'll start with the reaction first, because if the baby is having any sort of reaction, skin rash, turning blue, having difficulty breathing, vomiting, excessive vomiting, we want to stop feeding that food immediately, calling a healthcare professional just to check in, making sure your baby is getting the treatment that they need in that acute moment. Reactions, even if they seem mild, can turn severe, and they may happen immediately, but they could happen up to 2 hours after if we're talking about traditional IgE-mediated food allergy. So we want to, if we're seeing a reaction, pause. It could be a food allergy. It could be that the baby is just eating something that's irritating their skin, but you won't know until you wait and really assess. Tomatoes can be really acidic on the skin and can cause a redness of the skin. That may not be an allergic reaction, but still baby may be uncomfortable. and not want to continue eating. So if you're seeing a reaction, I would stop feeding and then take a moment to treat the baby and then assess moving forward. And then when we're talking about timeline for food introduction, I know the AAP used to recommend feeding a new food every 3 to 5 days. We're not going to get anywhere in diet diversity if we're doing one new food a week. Every 5 days, you're going to end up feeding like 40 foods in the first year. So I think that data is that, that's a little outdated. As I said, you will see a reaction pretty immediately for a baby. So while you may not be comfortable adding one new food every meal, you could certainly do one new food every day. A lot of, if you are doing purees that come in jars, that babies in the early infant stage isn't going to be finishing that whole jar. So you could spread that out over the course of the day and still incorporate new foods along the way. The reason for the spacing out was to assess for reaction, but you're not going to see a delayed react. Like you're going to see if the baby's
Right.
getting allergic reaction pretty immediately. And as we've talked about, we want to get more foods in, not 180, but we want to be able to get these babies more foods and have a diverse diet. If we're
Right.
talking about allergens, I would make sure you're not serving 2 new allergens, like top allergens, in the same meal. And for those, I might space out a day. Yeah. So if you're doing like eggs on Monday, maybe peanut butter on Wednesday, just so that you can make sure that you know what's going on.
Yeah, thank you so much. So I want to toss it to Dr. Nikki Ford for there's kind of an interesting cluster of questions here. One, I think, is the role of avocados in this whole, repeat exposure, not necessarily from an allergy perspective, but just from this dietary diversity perspective. So in the vein of kind of just preference formation, how many times, maybe if you want to respond to Keith's comment about kind of continuing to offer it, right, versus stopping at 3 to 4. And then perhaps also this anonymous question about how many times, if you do start with avocados before going to the other food. Not sure if that one's an allergy related question. But I think that it also just feeds into this macro part that you really brought a fresh lens to, Nikki, which was about teenagers. So anything you want to add in terms of culture, so again, in this kind of like preference formation, but also social norms, peers, the influence of crowds and so forth.
Sure, absolutely. And so thinking about something too and tying it to some of the stuff that Stephanie talked about is that I think at a bigger level than all of those questions is we want people to eat the foods that they're eating. So if we can choose things that are already familiar to the family, and so it does get a little bit challenging of I planning my introduction of my avocado on Monday and then on Wednesday and on Friday. But you know what? The family is eating tacos on Tuesday and they're eating salads on Wednesday. So I think fitting into a practical lifestyle lens that is really how people are going to eat and how the foods probably should be introduced to children anyway, to allow for the exposures, to reduce food waste, because if you're sharing with a family, there's less likely to be food waste. If you're choosing foods that the family enjoys, there are those cues sitting at the table that signal to the children that are starting to consume them that this is something I enjoy. You can even have wonderful conversations about how to eat the food. Like, oh, that sounds really crunchy. Like as they get a little bit older as toddlers and unfortunately start to reject some of the foods and then become adolescents and teenagers. And that's why their diet quality drops, because it is an age of autonomy and learning their own independence and freedom. I think that it's thinking about the word choice and normalizing it, and that this is just family meals. This is how we eat. And if it isn't a family meal, that this is something that my family eats and we all enjoy it. So you reduce that food waste because people are enjoying it. You're introducing potential foods that increase diet quality, not only by adding that, but the most common way that avocados are consumed are in soups, salads, sandwiches. Those are things that also bring whole grains and other fruits and vegetables to the table. So you're increasing diet quality just by, again, going back to those very basic foundation of how does my family eat and what is practical for my family, because I want to reduce waste, I want to enjoy what I'm eating, and I potentially want to reduce allergens and increase diet quality over time.
Yeah, so well said. Thank you, Nikki. So I'm going to invite Stephanie to answer Dina's question in the Q&A about seasonal versus shelved, which is a great question. And actually, Stephanie, let you come off mute in our final 30 seconds, NPR style. And I really think this is a key question from Cheryl about the cost reality. So cost of apples, $4.99 per pound. Orange, one orange is $1.25. A small avocado, $1.50. Even with WIC, keeping children fed properly is a lot to overcome. Any solutions? So
Yeah.
kind of including this in your call to action roundup, like quick rapid fire, what have you got? Because these are big, heavy questions.
Yeah, so WIC, just like SNAP, is intended to be supplemental. So ideally, there are other food dollars coming in from other sources. I think the biggest thing is, how do we shop on a budget? So we can utilize some of the same tips, like shopping seasonally, maybe buying in bulk is a little bit better. But I think there's a lot to be said at the retail level. How can we make sure that people are able to easily identify how much something is going to cost? That is just one of kind of the biggest things that I think that we can do, but do recognize that it is really challenging, especially, we've seen this higher benefit, which is great, but it's still not quite enough to really meet the recommendations for fruits and vegetables. So I think there's a lot of things just we can translate from shopping on a budget to the WIC population, but happy to chat further by email if that's easier.
Yeah, wonderful. And maybe if Stephanie or even Emily and team have any of their kind of favorite shopping on a budget links or resources, we could kind of huddle and include that in the post webinar email, because I do think that's a great kind of nudge there from Cheryl. So I'm going to toss it back to our host, Emily, to bring us home. But thanks again, everyone, for your attention. Really phenomenal questions. Panelists, great examples, as I said, of solutions in action, and look forward to all the follow-up. Back to you, Emily, and thanks so much.
Perfect. Thanks, Sophie. And thank you to all three of our panelists for a really insightful discussion. I think we're all leaving here with some new ways to just continue to encourage people to have a plant every time you eat. So one last quick reminder, fruitsandveggies.org. It's your one-stop shop for all things fruits and veggies. So whether it's sharing recipes or inspirational articles on how to serve certain fruits or vegetables, we really have it all, and we're continuously adding to it every week. So thank you all for joining us again. We hope to see you on a screen some other time soon. We will be at Fancy, booth 1126. So come visit us if you are going to be there too. Thanks, everyone.